You're listening to ParentMD, the podcast where top pediatric experts do the homework for you, sharing clear and trustworthy medical advice so parents feel empowered to take the very best care of their kids. Welcome to ParentMD, and we are fortunate to have with us today Dr. Steve Wright. Steve, thanks for joining us.
I'm glad to be here.
I appreciate it. We were just talking. This is the very first member-only podcast for ParentMD, and it's such an honor for you to be that first guest. And for the members out there listening, this is the first of many podcasts we'll have with such honored and esteemed guests as Dr. Wright and people who help us provide package content, stories, nuggets to help you be a better parent and pediatrician. So thank you for being with us today.
Again, I'm glad to be here.
Yeah, it's exciting. It's an exciting time for me in us launching ParentMD. I want to tell a little bit of why I invited Dr. Wright here to be our first guest in this capacity. And then I'll ask Steve to tell us a little bit of his background and career path, and then we'll kind of go from there and have a good conversation. Hopefully share some advice and nuggets and things that we've learned through the years that we think will be advisable for other parents and other doctors and such. So Dr. Wright, for me, was my very first attending in pediatric residency. And if you remember that far ago, back in 2001.
I do remember that, believe it or not. It just so happens that I had come out of private practice recently and had taken a job at the Children's Hospital. And 1 month out of the year, they had me attending. And just so happens that you were on my team.
Yeah, I just decided the year before to go into pediatrics and at Children's Hospital after graduating from the University of Louisville in 1998. And my very first month was on rotation in the wards. And at that time, they had different attendings rotate to cover in the wards. We didn't have hospitalists like today. That's a new entity.
Right.
So you came in, you were the attending, got to know you. And from that day on, we've been good friends and worked together in several different capacities. And we'll talk a little bit about that during the conversation. But fond memories for me and a lot of lessons learned in that month. And you're definitely a great role model to look up to at that time. And to just go on further with that, after I finished residency and started Oldham County Pediatrics with a couple other colleagues, I really have to give you the credit for being the one who pulled me in, engaged me in leadership back at the Children's Hospital, and invited me to be on committees. If I remember, that first one was the Medical Care Appraisal Committee, and involved in that as a community pediatrician. But from then, you kept me engaged and always involved me, and that meant a lot. I think that really probably is one of the my forays into the whole leadership world, honestly.
Well, you were a stellar resident, and you're certainly a stellar leader. I do remember during your residency, you had planned to start a pediatric practice in an area that had no pediatricians in it. And not only were you going to do that, you were going to invite, I think it was 2 other doctors.
Yeah, Dr. Weatherton, Dr.
So
Collins.
I'm thinking, this guy's crazy.
Especially when no one was starting practices back then.
Nobody
anymore.
was starting practices. Yeah. And for 3 people to go into this a practice on their own, I thought that was a little bit crazy, and like, I'm praying that this will work. And obviously, you added more doctors and became really one of the best pediatric practices in the area. And I remember during your residency talking about the business of medicine. We had a number of conversations about that, just telling you a little bit what I had learned in my practice.
Yeah, and I learned from watching folks like you, and as we'll talk about your career path, how you were part of a practice for years, and then Dr. Wright was also the medical director at the Children's Hospital for 20 years, and then we got to work together right after he came out of what was retirement. When he retired from medical director, he said he might want to do some more activities in the children's healthcare space, and if I had a space that maybe he could work with me, and in the Norton Medical Group, which we morphed with the Pediatric World and Norton Children's Medical Group, we invited Dr. Wright to serve as a medical director for us in the pediatric space and provide a lot of great work for us. How many years were you in that space?
6 years.
6 years, okay. So
I do appreciate that. It gave me an opportunity to kind of ease into retirement, which now I'm totally retired now. But it gave me, as I said, it gave me a way to kind of ease into total retirement, and that meant a lot to me.
Well, I appreciate it. A lot of fun for me, and I will tell the group here that we both exited from Norton Healthcare at just almost the identical time. When I shared with Steve I was going to leave on this entrepreneurial journey for ParentMD and Honaker Health, he had already been thinking about transition. We left within a few weeks of each other, a month of each other.
Month of each
so
other.
It was kind of neat for me, my career, to end at Norton in the corporate world at that time. Steve, would you tell the group, though, let's go back to the beginning and talk about your entry into medicine, because it's an interesting one, and then talk about your career path, because it, like mine, is not the traditional path of a general pediatrician. And then folks can see how our paths have intertwined, and then why I think it's so rich of an opportunity to bring you here to have such conversation, because the things I'm going to ask you later, what's your advice for parents, advice for pediatricians? If you had children again, what would you do differently? What are those nuggets? And that's what we're going to talk about. But to understand that, I think it's kind of key to know your background. So why don't you tell how you first came medicine, which is one of the best stories.
Well, one thing, when I was medical director at the Children's Hospital, I interviewed a lot of prospective residents, and it always intrigued me that many of them knew from grade school that they wanted to be a pediatrician. Well, that wasn't anything like what I was doing and what I was thinking. So actually it goes back to the 9th grade when this journey started, and I was assigned an assignment to write a document on Egyptian burial practices. So I did that. I became interested in American burial practices and actually worked at a funeral home. So my deal was I was going to be a funeral director. Huh. And at the time, they passed this rule you had to go to 2 years of college. I wasn't even planning on going to college. Wow. I was just going to mortuary science school, and I was going to be a funeral director. But they passed this rule you had to have 2 years of college. So I enrolled at Eastern Kentucky University, got in the pre-med program because of all the biology and science. I thought this is going to help me.
Sure.
After 2 years, I'm like, well, that went by pretty quick, so I'm going to stick it out. And I had a pre-med advisor. We're still friends to this day and communicate. And he kind of convinced me that maybe I could do a better job and help more people by going into medicine. So my plan on going to med school was to go to U of L. It was one of the best medical schools to put out doctors who practiced well and just took great care of patients. So that's what I wanted to do. I had a research project at EKU on the EKG development in chick embryos. So I got interested in cardiology, and I thought I was going to be an adult cardiologist. I'm an only child. I didn't know anything about kids. I didn't have any brothers or sisters. And so that's kind of what my thinking was when I went into medical school. And then in the clinical years, you start rotating, around the different disciplines. And there were a couple of defining things in medicine that turned me off from general medicine. And when I went to pediatrics, the professors were nice. They didn't holler and scream at you like some of the surgeons did. And the professors, the doctors there, their lectures were terrific. I mean, well organized. They were interested in imparting knowledge to you. And then the kids, they couldn't help what was wrong with them. And they were just fun, and they took over my heart. And that's kind of how I decided to go to peds. So I did my residency here at the U of L affiliated hospitals. My game plan was actually to go back to my hometown. It was Covington. My wife and I had talked about that, and we decided if we got an opportunity to stay in this one practice locally, we were going to stay in Louisville. And lo and behold, that opportunity came up. So I joined that practice and stayed there. I was in private practice 21 years. We went from 2 docs to 5 docs. And I was president of the medical staff in 1992 when the medical director at the time, he had been in that role for 13 years, retired. A couple people asked me if I would be interested in the medical director's job. I'm like, no, I wouldn't want that job for $1 million. I'm a senior partner now, and, I'm safe. Well, one thing led to another, and I did accept the job at the Children's Hospital. And as you said, I was in that role for 19 years until I retired.
You highlight a couple things I want parents to think about. There's two common reasons pediatricians decide to become pediatricians. So when we're going through medical school, we're not always sure what we're going to be, but it's often based on our relationships from mentors and how we were impressed upon people like, hey, I like them. They were nice. I want to be like them. And that's a constant thing. That was one reason I really liked pediatrics. I thought the pediatricians were just super nice. And some of the initial ones I had in third and fourth year of med school were just, Dr. Bratcher, Dr. Rabley, many of those were just, I was like, I want to be like them and I want to be around them. And then obviously it was also the patients. So these little kids, so you just like, well, this is like perfect. I get to play with the kids and they didn't do anything wrong and I'm here to help them and it feels so good when you're appreciated by parents. But when you went, like I did, down the leadership path, when you went into the medical director role at the hospital, what was so fulfilling about that? What could you tell parents that was fulfilling in a scheme of leadership versus one patient at a time? Because I think a lot of people wonder why if we have a heart for pediatrics, why we would leave the bedside. And I think we each got similar reasons. So maybe comment on that.
Yeah, leaving the bedside, as you put it, was not easy for me. As I said, I was a senior partner. I loved my patients, and it was a difficult thing. But medicine was changing at the time. The business of medicine was becoming more prominent, and decisions were being made that didn't involve physicians. Making the decisions didn't involve the doctors, but the decisions certainly did. And it was really a need to have physicians in leadership roles that can help with those things. And when I first went to the hospital, I felt like my mission was to take care of 3 spikes on a hub, and that was the hospital, the academic community, and the private community. Keeping those melded together on a path, that they're all on the same path, and we're taking good care of patients, but we're also taking good care of physicians in the hospital, because you got to work together to do that. Things have changed a little bit now, where the private doctors, are kind of pretty much divorced from the hospitals. But at the time, there was a need to have physicians in leadership roles to make sure the right decisions were being made by what I called the bean counters.
Yeah. Well, I think this is key for our parents, our members, to understand. Traditionally they think of the pediatrician's role at the bedside, and those are the ones they interact with. But I want them to know and understand why and realize the roles of a lot of other pediatricians, such as ourselves, who've gone in different spaces. And for me, and I know what resonated with you, is just as you said, physician leaders are needed at these tables. And the nice thing in our world today, the administrators recognize and they want physicians with them. So it's become a great partnership. But what excited me so much about it, and you too, was we were able to impact hopefully the lives of a bigger population, with a policy, a procedure, or a statement, or an influence speaking at a meeting. So the ability to kind of work in a different way as a pediatrician. I always said I practiced medicine just differently the last few years, and supporting others to practice medicine in a way that was great at the bedside. But not all pediatricians go down traditional roles, and we'll have more of these conversations with others as well. So.
Yeah, that's absolutely true. The only thing that I kind of regret maybe is you don't get that immediate feedback from the patients and stuff often.
And you don't get the closure.
You don't get the closure.
You don't get it at the end of the day, say, I took care of all these kids, now I'm worried about these tonight, but I know in the next couple of days, 99% of them will be better. Right. Where the administration world, problems just go on for years.
It seems like it.
And some things you feel like you never get closure, but when certain things go well, you've helped a lot of people.
Right. On the other hand, when you can bring a new service line onto the hospital, you can bring new doctors in, new specialists in that you didn't have before. Boy, that's patient care.
Yeah, and that meets a gap and a need that didn't exist. So with that, I want to come back now and think about your role as a grandparent too. We were just talking about your boys before, and for this group to know, one of the best and highest honors I had always when I was in private practice was when people from the community that I esteemed or people I highly looked up to me and trusted me with their children. And Dr. Wright was one of those who he asked me one day if I would be the pediatrician for his 3 grandsons.
That's right.
And that was a real treat for me. It's one of those hallmarks of my career. So let's think a little bit. I've got 2 boys older, I've mentioned to this group before, and you've got 3 grandsons, 2 daughters, 3 grandsons. Let's think about now and reflect over, we talked about your career and the different roles you played, but I wanted to give all that background so the parents would appreciate the value of the comments that I'm getting ready to ask you to make and think about.
Okay.
Because I want the parents to hear some of these nuggets and bits of advice that you have for them as parents. And obviously pediatricians listen will really appreciate these too. But when you reflect on your role as a parent and a grandparent now, and being a pediatrician and all these different roles through the years, share with us, as in the time we have, some of those bits of advice. What's your top few pieces of advice you would give to parents today when you reflect? And if you were to have kids again, how would you do it differently?
Parenting is not easy. And I think before you become a parent, a lot of people think it might be pretty easy, but it's not. And I've always felt like the school systems should have mandatory parenting classes.
Amen.
I mean, we have math and all that, and there are subjects that they make kids take that they'll never use. But most kids are going to grow up and be parents. So to me, that's something that is really needed. So parenting's hard to do. Your kids don't come really with an owner's manual. You got to kind of figure that out on your own. One of the pieces of wisdom that one of my attendings gave me when I was a resident myself was a simple little phrase, but over the years, I found this has got incredible amount of wisdom in it. And that was, he said, Steve, little kids have little problems and big kids have big problems. And following my patients and my own family, I've certainly found the wisdom in that. So that's something that you don't stop being a parent. I mentioned this to you earlier. My mom was about 60 years old, working for this company, and her boss had been out late one night, and he gets home, and his 90-year-old dad is waiting at the door for him, and he's like, Dad, what are you doing up? He said, Son, I was worried about you.
Yep.
Perfect example that you just never really stop being a parent. One of the things I would tell parents is do everything you can do to boost your child's self-esteem, parents and grandparents. This old phrase that sticks in stones will hurt my bones, but names will never hurt me.
Yeah,
that's a big falsity. I'll just tell you a little personal story that's a little bit silly, but it's a perfect example of how a word can affect somebody. So my mom and dad were divorced when I was about 2, and I had to go visit my dad every other weekend. And one day I was there, and there was some bananas. I was peeling the banana, and those little strings that come out, pulling those little strings off, and he's making fun of me. And Josh, to this day, I'm 75 years old. Every time I peel a banana, I think of that. And I don't really think of my dad much of anything else. That's stuck into my head.
Right.
And when a parent tells a child, hey, you're bad, or some other derogatory thing, you'll never learn this, or you'll never get over that, that sticks with them a lot longer than you might think. So I would encourage parents and grandparents to boost kids' self-esteem and just be careful what you say and how you say it.
Yeah, I tell you what, that just brings up so many thoughts for me. I'll share with the group, the members, one thing I want to do through the years with ParentMD is be honest and transparent about my struggles, my lessons learned, so hopefully others can learn quicker than I did. I was very much an authoritarian type of parent, despite being a pediatrician, meaning I was about the rules, and I was firm on those, and I was pretty firm on my 2 boys. They would tell you looking back, and doesn't mean I wasn't loving, and there to meet all their needs, but I was definitely, I would say, more critical than I should have been. And the funny thing is, my parents were never critical with me. But, I was critical in the way that I expected. I just had high expectations for them and wanted the best for them. But there were times I crossed the line and wasn't as supportive. And I know I said things that probably hurt and lowered that self-esteem. And those are some of my biggest regrets as a parent.
Yeah.
And when I look back at what things I could do differently, I wish I looked through the lens of more maturity and more wisdom of a father in the 20s. But, sadly, some of those things you learn as you go and you reflect on them differently. But that power of words, if we took nothing else from this conversation today, I hope parents are listening. And, it's something we hear, we all know, but I don't think you can ever hear it enough. And given that illustration that at your age, you still reflect when you eat those bananas and think of that,
yeah.
it sticks with you. Certain things stick in ways you don't know why. And I've said that wasn't anything what one might consider harsh, consider what others had, but those things stick with you. But as a kid, when you're critiqued, any kind of critique can drastically change a relationship forever. And even if it's not meant in the tone it comes across, but the words are powerful. So I appreciate you bringing that up.
The other thing I would used to tell parents is to be honest with your children. If a child wants a bicycle for birthday and they're told we can't afford it, and then mom or dad goes out and buys a car or something like that, they pick up on that very easily. And kids are always watching, even though their parents may think they're not. They pick up on stuff, and they know more than we give them credit for.
By far.
The other thing I would say parents need to be, and grandparents too, whoever has a role in raising children, need to be consistent with their discipline. What I've found so often is kids learn very quickly who they can manipulate. And if mom's tough and dad's easy, they may go ask mom and she says no, and then they'll go to ask dad and he says yes. Well, that's not being consistent. So mothers and fathers, grandparents, whoever's in this role with kids, they really need to be consistent. They need to know mom and dad is a team.
No, I'll go with that. At the end of the day, the parents have to be aligned. And if they're not aligned and kids get different responses, then they're confused. It's kind of like that dog that's named Stop, Go. Come here, stop, go. The dog's confused, gets two totally different messages. And I think it's one of the hardest pieces of parenting is being aligned with one another and being consistent. And then when you have to make those hard decisions, when to discipline, when not to, when to provide certain feedback, that's hard, probably the biggest challenge, but probably one of the biggest things that we often do wrong as parents as well.
The other thing I would say, and this might be one of the most important things for parents and grandparents, is to follow your gut. You know your kids better than anybody, and even better than the pediatrician sometimes. You know them better. And if you think something's wrong and the doctor is kind of blowing it off, which happens, you just keep pushing until you get an answer and you're more comfortable with what's going on.
I think that's a great one. We've talked about that a couple other times with other physicians, is parents being bold as they know their child best. And if they need to be bold and push with the physician, because again, physicians, we've got to be listening, knowing the parents know best. And no, that's a great point. Let me give you one thing that I was kind of thinking about, and if I don't say it, I'll forget it. But one thing I learned from you one time when I received good criticism from you as a resident way, way back when, after I had been, and you'll remember this probably when I share it with you, but this is the boldness of a parent or boldness of a mentor. Sometimes you have to say things to the people you're leading. So the power of words is key to not say the wrong words, but then there's the power of words when you're helping people be on the right path and give them constructive feedback. So I'm going to pivot just a little bit here because this just popped in my head. But when I was a resident, it was probably a year or so after we had worked together, I'll never forget there was a parent that called you, or no, a doctor from the community who called you after a patient had been seen in the hospital. I was the resident taking care of them, and they had asked me while they were in the hospital, they were there for I don't remember what, but I remember that they had asked me to look in their child's ears, like the day, but they were getting ready to go home. well, they said, he's tugging his ears or it might hurt. Would you mind looking at his ears? And I remember I blew it off because they'd probably been admitted the day before because you're usually in the hospital for a day or two. And I was like, well, I just looked at them yesterday. They're fine. And I didn't go and follow that mother's instinct and ask and that need to look in those ears that day. I'll never forget. They were discharged, went home to their private practice doctor. Sure enough, that doctor's calling you because the kid has an ear infection. And I remember you called me. Either you caught me in the hall or the office. I don't remember now. You might remember. And I remember you shared with me that story and you said, hey, a lot of what we do isn't just doing what needs to be done. It's reassuring people that everything's okay. And normally you would have been right that those ears probably been fine when you looked at them. But this time you weren't. And man, boy, I felt terrible because I highly cared what you thought about. But those words of boldness and telling me what I need to know and give me that true feedback, it impacted me the rest of my career. If anybody ever had a need, not only I want to meet their need, I want to make sure I wasn't missing something.
Yeah. And
I want to make sure I was reassuring them, even if I thought nothing needed to be reassured. So there were so many nuggets for me in that one little interaction. You and I have really never talked about it since in 20 plus years, but it just kind of came to me as we're talking about words and the power of words in a different way.
Yeah. Well, the reason I did that was because of something that happened to me.
Okay.
I guess maybe I didn't tell you this, but I had a patient that was adopted as a teenager and had seen him for a number of visits over time. And the mom came in one day and with him and said she was concerned he was anemic. And trying to be the academic piece of me, I'm looking at signs of anemia, physical signs of anemia.
And you're telling her all the reasons he does not have anemia.
He doesn't have anemia and he doesn't need a CBC. So she switches doctors went to somebody else, and I came to learn that the child was anemic, or at least she was told he was anemic.
Right.
And put him on some iron. And I lost a patient because of that. And that was hurtful. You don't want to lose patients. I mean, you want to do a good job for them. So I didn't do a very good job on that. But obviously that experience that I had transferred to some advice I gave you. So I was really preaching something to you that actually happened to me in a lesson I learned.
Well, I appreciate that. If you think of our years through leadership and the years of mentoring, that really is, I would like to think, where we have had some of our most fulfilling times as folks we work with. We share with them not only feedback they need to hear, as we're the leader in their space, but we can obviously usually relate to something that, hey, I experienced that also. And to me, that's probably one of the biggest lessons here as we talk about parents is please share your learnings with other parents. Take a sense of ownership when you have nieces or nephews or cousins or any other family members or friends, and bestow your wisdom and your learning experiences, because sometimes those stories, the power of words, can be so helpful to another parent. When I look back all the things I learned through the years as a parent, it wasn't just from what I experienced my own, but often was mimicking and watching other parents or listening to other parents talk, or every once in a while a parent pulled me aside saying, put an arm around me and give me a piece of advice. My mind goes to many of those situations through the years. And, I think we have a community responsibility to help one another in those areas. So if you had a newborn in front of you, Steve, and you were going through this cycle again, and you're like, not going there, but if you were, what's the one thing that you would do differently now than you did when you raised your two daughters?
Let me think about that a second. I think I did a pretty good job. Well, my wife did a pretty good job of raising our daughters. I think we kind of touched on this earlier. The practice of medicine when I practice is much different than it is today.
Yeah.
There weren't hospitalists. When your patient needed to see you, you didn't just send them to the ED.
Did you go to the deliveries also back then?
We went to the deliveries.
So you went to the deliveries. You took care of them in the nursery. When they went to the hospital, you took care of them. You were on call 24/7. You didn't just do the ambulatory outpatient practice, which is traditionally what most generalists do today.
Yeah, no, we did everything, and we didn't have a lot of subspecialists either. I mean, you took care of diabetics. You took care of kids with renal disease. We took care of kids with cystic fibrosis. We didn't have any pulmonologists back then.
All right.
So the practice was so different. You had to go take care of your patients, and obviously you missed some Christmases and Thanksgivings and some things like that from time to time. I was lucky in that regard because we had a group that shared night call with a couple other groups, and that was something that was not done much back then. I mean, you would talk to other pediatric groups and say, "You want to join our after?" No. Our parents, they wouldn't go for that. They need to hear from me. If I had to do it differently, I would try to spend more time with my kids, but I didn't miss really any of the functions my kids went to. I mean, 4 or 5 hour dance recitals, I was there.
Yeah.
Today, it's a lot better in that regard. Physicians have more opportunities and more time available to really spend with their families.
Yeah, I think doctors today, as they've gone into the career of medicine, they go through medical school and residency. Obviously, we have the work limits in med school and residency compared to when we trained. Right at the end of my training was I started instituting the work limit and work duty hour restrictions during residency. But for the families today, there's definitely much more balance in life, and the doctors have more of a package schedule. So hopefully our doctors are able to have more balance today, and then that, I think, makes them better doctors too. So then as our parents can go and see them, I would think our doctors are more rested and able to focus on them more. And I think as generalists, they're able to focus on what they do versus being pulled, getting those calls from the hospital, the kid in the NICU or the kid being delivered, or kid in the hospital or the ICU. You often have to run and get distracted back and forth. So I like to think for our doctors and families today, the package of medicine is better. And then, you like myself, I wasn't ever on electronic health record. I left practice right when they transitioned. So I never had to do anything but a pen and paper, and the same as you. And then also the day today of the internet and the age of the internet with able to access information. So the practice of medicine has changed so much, I think a lot for the better. I think things, and we've had a lot of conversation with our doctors, things are more patient-centric, more holistic, more of a team partner approach. The parent and the doctor work on things together versus used to is very top-down. Doctor says this, parent did this. So I'm excited where things are going, and there's a lot of good changes. It was great when the doctor could be in the whole spectrum of care for that patient from birth in the hospital and everything. But at the end of the day, I do think it's better today for many reasons.
That's something that I would miss, the birth to teenage years, college years. I would miss that because I came to know my families very, very well. Actually, several of my patients are pediatricians now. You probably know who they are.
Yeah.
And hopefully I had something to do with that because just seeing them from babies and working through their parents and getting to see them graduate from school, it's very, very...
Chris Wilmers.
Well, who is that?
I don't know. I am so sorry.
Now, with that being said, that probably brings back some of my favorite memories working with Dr. Wright. For the last several years, he's had that ringtone on his phone. And I can't tell you the levity that's provided in many meetings through the last few years. But to me, that's classic because that gets at the heart of who Dr. Wright is and his identity and his joy for children. That's probably brought many laughters, hasn't it?
I'm sorry, but it has. Right. I mean, sitting in meetings and I'd forget to turn my phone on off, and invariably, just like now, somebody would call me, and of course, it would bring laughter to the room. And sometimes it just came at just the right point where we needed a little break. We needed to take a big deep breath on some things that we were discussing. I found that years ago, and I think it was perfect for a pediatrician.
Oh, it is.
I'd asked Heather, what advice would you have? And she said, they need to smile more. And she gave me this example. She's a child life specialist, and she was in a room at the hospital, with a patient. One of the specialists came in and started doing his thing, and the patient says, "Dr. So-and-so, don't you ever smile?"
Oh, my.
And to his credit, he backs up and he says, I've been so busy today, and I've got you on my mind and all these other patients on my mind, and I need to smile more. And just think, when you go into a restaurant, if the waitress or waiter doesn't smile a little bit, it leads to a visit that could have been a whole lot better if they would have smiled. So I would just say to pediatricians, smile. I would remind them it's no fun going to the doctor's office. Parents, it's not fun for parents. It's not fun for kids. Just remember that. And don't forget why you went into medicine in the first place.
So true.
It's very easy to get locked up in all the business of medicine and the politics of medicine. And you can get so consumed with that, it takes the fun away from giving parents good advice or making a diagnosis of this, that, and the other. So they need to just remember why they went into medicine in the first place. And then finally, I just say this has helped me over the years in dealing with patients and actually cutting down on phone calls to me. Tell them what's wrong with their child, what your recommendations are for treatment, how you expect and when you expect things to get better. Are they going to get better in 2 days or a week?
Yeah.
Tell them that, and tell them what to look for if things don't go the way you think and when to call you back. And if you can tell parents that on each visit, they'll leave there with a lot of comfort and they know what to do.
And on the converse side, it's good for parents to know what and how to package information when they call the doctor.
Exactly.
If they can have notes, be clear and concise to what their concern is, how long it's been going on, and all the questions they know the doctor's going to ask. But it's good if you have that written down and prepare a little bit. It sets up the doctor also for success. I'll take a minute to thank you for all that you've done for this community and your role as a private pediatrician, your role in the hospital leadership, the role in the last few years at the Norton Medical Group, and the joy I've had working with you and the mentorship you've given me through the years. Boy, what a treat and pleasure to have you here today and help us kick off our podcast series for ParentMD and to be here to share that bit of advice. So thank you for being with us today.
Josh, it's been a lot of fun, and it's been an honor for me. I wish you the very best with ParentMD. It's something that's really needed, where parents can go to one place and get accurate information. You can go out on the internet and Google something and no telling what you're going to find, and much of it's not accurate. So what you're putting together here is something very much needed. I'm glad to be a part of it.
Yeah, well, we appreciate all your words of wisdom and all the nuggets, and much appreciated. So glad to have you here today.
Josh, it's been fun.
Thank you.
Okay, you're welcome.
You've been listening to ParentMD, the podcast where top pediatric experts do the homework for you, sharing clear and trustworthy medical advice so parents feel empowered to take the very best care of their kids. If you enjoyed today's episode, go ahead and click on that follow button on your favorite podcast app. It's the best way to make sure you never miss a single episode. And while you're at it, why not leave a 5-star rating and comment as well? We'd love to hear your feedback, and it helps other parents find the show. The ParentMD podcast is a part of ParentMD, a new way for pediatricians to help parents. ParentMD is an online source of parent information you can trust, straight from board-certified pediatricians. For more information about ParentMD, visit us at our website, www.parentmd.com. That's it for this episode, but we will be back soon to tackle another topic to help parents make confident and informed decisions about their children's health.